Good afternoon, everyone. Beautiful summer's day, first day of summer.
Yes.
So it's a lovely day to be celebrating our staff awards. So welcome. My name's Claire Woods, and I'm the Executive Director at Ballarat Health Services, or as I should say, Grampians Health Ballarat, which is the organisation that we're now part of. But today is very much about celebrating our Ballarat Health Services people and their wonderful achievements around the values of the Ballarat Health Services today. So on behalf of Ballarat Health Services, I'd like to acknowledge the traditional custodians of the land on which I am today. Being in Ballarat, I'm on the Wadawurrung people of the Kulin Nation. I pay my respects past to all the traditional custodians of country throughout the Grampians region and their connections to land, waterways and community. I pay respect to their elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples here today. As we're joining this event virtually, I encourage you to pay your respects to the traditional custodians of the land you are on, which there are many, and please feel free to share the land on which you are on in the meeting chat. I would like to welcome any of the Grampians Health Board of Directors who are joining us here this afternoon. For many of them, this will be their first experience of our celebrations. Noting, of course, they would have had the opportunity to join our awards last night, which was another fantastic event. These awards today are part of BHS Together, which is an opportunity to recognise and acknowledge some of the incredible work that our staff have undertaken throughout 2021. We're pleased to bring together the presentation of these awards and collectively recognise some of the outstanding efforts from staff and community members to Ballarat Health Services in 2021. It's been quite a year, and having looked through the winners today and having the privilege of looking at the nominations over the weeks leading up, I can say today is very much about celebrating those people who probably were not on the front page of our local newspaper or highlighted in a television story about the pandemic. These are the people for whom our organisation really stands on their shoulders. They make the organisation what it is, and they go about it by demonstrating the values every day. I encourage any of the award recipients who wish to speak on receiving the award to please do so. Just turn your microphone on, and if you would like to do that, if you would rather not, that is fine also. And because we're now very au fait with online meetings, please use the chat function to pass on messages of congratulations or job well done, because it's wonderful to read as we go through the meeting, those messages of support from friends and colleagues. Please note that the event is being recorded and will be made available for staff and their families to watch if they can't join today. So watch out for the recording in the coming days. Now, let's get started. Being an online meeting, it will be, we'll keep it moving and it will run fairly swiftly through the awards. I look forward to hearing some great stories. You would be aware if you work on site at any of our services that there's been something missing over the last 2 years. Because Ballarat Health Service, we really value the unique qualities that only volunteers can bring to the organisation. Volunteers enrich our programs and they enhance the successful operation of Ballarat Health Services. We rely on the commitment and the efforts of our volunteers daily, and it's essential that we recognise their efforts in making our service what it is. Every year, our volunteers are recognised for their efforts and awarded the title of Volunteer of the Year. Usually, in determining who will be awarded Volunteer of the Year, a range of selection criteria is used. The past year has been incredibly challenging for our team of dedicated volunteers who, because of COVID-19, have not been able to make the contribution that they do to the organisation. We are very conscious that the organisation has suffered real loss in not having them on site, and I know from hearing the feedback from Claire and the team that sense of loss has also been very much felt by our volunteers. One thing we hope is that 2022 brings those volunteers back into our buildings, our facilities, our aged care residences, and we are able to again have the positivity and the vibrancy that our volunteers bring. But there is one group of volunteers who we are able to celebrate today, and can I just commend them for their consistent efforts and their persistence, particularly through the COVID time in keeping one of our essential services running. This year, we are recognising our brick driver team as our everyday volunteer heroes. The volunteer brick driver team provides timely, efficient, but most importantly, person-centred transport to brick patients and clients of our cancer service. They bring them to and from medical appointments and allow them to access care that for many of them, they would not otherwise be able to receive. We're now going to show you a video from Steve Medwell, who's the Operations Director of Medical Services, to share with us a bit more about the work of the brick drivers. Thanks, Emily.
Hello, everyone. I've been very fortunate to be involved in the oncology service here at Brick since 2013. And one of the most important services that we have here is our volunteer patient transport service. It's an amazing service. We're supported by a whole troop of volunteers who man our cars and assist us with bringing patients in for their cancer appointments. Obviously, really important appointments for patients to be able to attend, and without this service, we would see about between 10 and 15% of our patients wouldn't be able to receive their care. These are patients who don't have any other transport options or might have some challenges in organising their families to be able to bring them into Brick. We know that a lot of people, families are all working these days, and it does create challenges for families in bringing their loved ones in. So it's one of the things that we're really proud of, that there are patients who do not have any other option to be able to find their way here, do have an option. One of the things we hear about cancer patients and their experience is the relationships that they build with the support team who look after them, both those staff who are treating them, but also our volunteers. So in the same way that the patients form relationships with their treating staff, they do the same thing with the people who are bringing them in and out each day. The patient spends so much time in the car. Patients can be coming from 70 or 80 kilometres away and spending that time with our volunteer drivers, who are expert communicators, incredibly kind and compassionate, create a real connection with their patient, and that's really important time for our patients to feel at ease, to feel calm, to come in to have their care and feel really positive about what they're going through and what's happening. So it's a really important service for our community, and incredibly important to each individual patient who receives that care. A big shout out to all of our volunteers who've been working through the last couple of years through the various different stages of being in and out of the hospital, and we thank them for what they've done, what they continue to do, manning our couple of vehicles that we have in bringing our cancer patients in for care. So thank you so much. You do a magnificent job. We're very grateful to you, and you're such an important part of our team, and look forward to working with you now and into the future.
Thanks, Steve, and thanks to Emily for putting that video together. That's a great great summary of the great work that brick drivers do. Now, Bernadette O'Loughlin is the team leader of the brick drivers, and Bronwyn Allen is the BHS staff member who coordinates the transport. And together they lead a team of 10 incredibly enthusiastic drivers that take real pride in the important role that they play within Ballarat Health Services. I'd just like to call out by name those people, and my apologies in advance if I've missed anyone, but we've got Bernadette O'Loughlin, who's the team leader, Tom Buscombe, Mike Chennell, Fred Dewsbury, Ian Everett, Peter Lenfers, John Quick, Judy Savage, John Fox, Tony Seymour and Alan Campbell. Over the past 18 months, the brick drivers have been, I don't like this term, but have been stood down on a number of occasions. Each time they were unable to carry out their duties, it threw the program into turmoil, as without them, many brick patients and clients were unable to attend their medical appointments. In June this year, as Ballarat was about to go into another statewide lockdown, the question was raised about how we could continue to provide this crucial service regardless of restrictions. So Volunteer Services prepared a proposal requesting that the program continue to operate during the period of lockdown, working with our clinical ID physicians, health and safety, and a whole range of other people. Some criteria were established that meant that we could continue to deliver the service with some very specific safety measures. The team report they were thrilled when the recommendation was approved, and they were able to get back behind the wheel and do what they loved. Several members of the brick team, sorry about that, the brick team promptly rescheduled their vaccination appointments, bringing them forward so they could return to help as soon as possible. The brick drivers are extremely worthy winners of the 2021 Volunteer Award. They are dedicated to working together in the best interests of patients, medical teams and other staff members. The Brick Driving Volunteer Program has been in operation for 15 years and looks forward to being able to continue to provide such a vital service to our patients in the future. Now, Team Leader Bernadette has been very organised. She's pre-filmed an acceptance speech, so I'll hand over to Emily so we can see that.
Thank you. On behalf of the volunteer brick drivers, we don't expect any awards when we sign up to be drivers. We get rewarded by the people we can assist in a small way, but it is appreciated. We've been fortunate, we drivers, that we've been able to resume work this year, or as volunteers, and we hope in 2022 all volunteers at Ballarat Health Services will be back on deck. And so on behalf of, and I'm going to read this folks because I may just lose someone, Judy, Tom, Mike, Ian, Tony, Peter, Fred, John Fox and John Quick, I'd like to thank you for this acknowledgement on behalf of the volunteers. If I may, I'd like to make a special mention of Alan Campbell and Jeff Hareen, who have just recently retired after many years of volunteering in Brick as a driver. Thank you.
Thanks, Bernadette. The next awards that I would like to present, again, go to another group of unsung heroes. These are our BHS Together Safety Awards. The safety awards are designed to celebrate teams and individual staff members who contribute to the health, safety and wellbeing of our employees and volunteers and show continuous improvement in business performance. The awards recognise those individuals and or teams who have made outstanding contribution to our business, particularly related to the safety of our health service. There are 3 categories in the awards: the Health and Safety Representative of the Year, Safety Leadership or Improvement Individual, and Safety Leadership and Improvement Team Award. The awards are open to all employees, and all staff are encouraged to nominate individuals or teams who continue to exceed the requirements of their roles. These individuals or teams have lived our organisational values with their achievements, having a meaningful and lasting impact on Ballarat Health Services. The first award in today's Safety Awards is the Safety Leadership Individual Award. The award is designed to recognise leaders in safety, whether that be a manager, a supervisor or a team member taking on exceptional safety leadership. The award is designed to showcase winners for their efforts to improve or sustain high health and safety standards. And I'm pleased to announce that this year's winner of the award is Glenys Kirkham. Glenys is an enrolled nurse at the Sebastopol complex, working across James Thomas Court and, until its paused recently, the Transition Care Program. Glenys identified an issue where patients were admitted without full prior assessment of patient handling needs. This issue was raised after a bariatric patient was admitted and the appropriate equipment and training was not provided. Glenys worked through the solutions with her team, assessed and rectified identified risks, and ensured safety for the residents and staff at her workplace. Well done, Glenys. And if you are on the line, I will hand over to you to just say a couple of words. Doesn't look like we've got Glenys on the line. So I will make sure I will accept the award on her behalf and make sure that this recognition gets to her along with the lovely messages in the chat. The next award I'd like to announce is the Safety Leadership Improvement Team Award.
Emergency Bay 4, all clear.
This is a team award to encourage and recognise teams who have displayed outstanding leadership and to showcase winners for their team efforts in improving high health and safety standards. And this year's Safety Leadership Improvement Team Award winner is the Primary and Community Care Health and Safety Committee. The committee has been a long-standing, high-functioning team of people committed to improving health and safety across the directorate and the organisation as a whole. Key areas that they have excelled in include proactive management of risks. Each health and safety worker has the opportunity to raise potential risks and actions, and with action plans to address. Excellent representation and attendance across the directorate. Directorate injury rates has been well under the set targets for all of 2021, and the risks highlighted across the directorate are really well aligned with the Directorate Risk Register. The Health, Safety and Wellbeing Chair, Michelle Oliver, meets with the Primary and Community Care Operations Director to go over reports, data, identifies trends, and supports them to develop actions to proactively manage risks. I'd like to welcome Michelle to accept the award on behalf of the team. Over to you, Michelle.
Thanks, Claire. I'm pleased to be able to be here to accept the award on behalf of the Primary and Community Care Group. This group evolved, actually. It used to be called Subacute and Community, and when all the directorates changed around a bit, it became the Primary and Community Care Health, Safety and Wellbeing Group. I guess I'd just like to pass on special thanks to the health and safety reps for their engagement and enthusiasm and their contribution to our meetings. Also, thanks to Craig for leading the group, Craig Wilding, and special mention to Tony Depler, who no longer works at Ballarat Health, but he's been a great support from the Health and Safety Department over the years. This team certainly is very proactive in identifying risks, and we work together as a team to try and mitigate those risks. So thank you.
Thanks, Michelle, and well done to the Primary and Community Care Committee. And that value of teamwork is really evident in the work that you do. So the final award for me to announce in the health and safety category is the Health and Safety Representative of the Year. This award is designed to recognise a health and safety representative who's implemented a solution to improve health, safety and wellbeing. It looks to recognise initiatives to establish, improve, inspire and maintain best practice in health, safety and wellbeing by a health and safety representative. The 2021 Health and Safety Representative of the Year is Anna Glenn. Anna was nominated by Pauline Basilio for her efforts. The words in her nomination by Pauline are these: "It's not one single issue or activity triggering this nomination, but rather a track record over many years of being a proactive, engaged and passionate HSR. Anna has been the HSR in Health Information Services for 6 to 7 years. She continues to undertake the responsibilities of an HSR with enthusiasm and genuine regard for the safety and wellbeing of her colleagues. She works with myself and the Deputy Manager in a collaborative, proactive and respectful way. Anna has been actively involved with higher level health and safety committees over the year also. Recently, on Brighton Ballarat Day, Anna organised show bags for her colleagues containing sweet treats and inspirational messages. This act of kindness is illustrative of Anna's care for her colleagues' wellbeing and the provision of a safe workplace. In what is a somewhat thankless task, Anna brings a great feeling of positivity to her workplace. So congratulations, Anna. And if you're on the line, I'll hand over to you to just say a few words. Hi, Anna.
Hi. Thank you. Was not expecting that at all. I have been HSR for quite a few years now, and I really enjoy the role. I'm really lucky that I have a supportive managers and proactive team members that all work together. Yes, I'm very proud to be a part of keeping BHS as a whole a safe environment, and I'm grateful for the opportunity to do that. Safety is key in all workplaces, and it makes it easier on everyone when everyone's striving for the same goal. I believe our shared goal should be to continue to work together across the hospital, not just individually in our individual designated groups, ensuring that we're all working together as one. Yeah, so in this environment, I think keeping the positivity and spirits up has been quite important. Yeah, but thank you. I'm completely unexpected and a little humbled. Thank you.
Thanks, Anna. A very well-deserved award. And
great at public speaking.
that you have found a new talent, perhaps. Thanks, Anna.
Thank you.
I would like to say a particular thank you to Anna and the nominees and recipients of this year's award, but I would also like to use this opportunity to thank all our health and safety representatives. We have a very engaged group of health and safety representatives who do a wonderful job in carrying out their roles. Sometimes it's a thankless task, but they are wonderfully engaged, and a big thank you also to Chrissy Stone, the Director of Health, Safety and Wellbeing, and the Health, Safety and Wellbeing team for their engagement and care for our HSRs. Fortunately, it's now time for me to hand over to hear about the winners of our Value Awards. So it gives me great pleasure to hand over to Ben Kelly, Ben Kelly is the Executive Director of Acute Operations, but he is also a member of the Compassion Ballarat Committee. You may even be the chair, if that's right, Ben, is it? So Ben is certainly someone who is a holder, along with all of us, of the values of BHS. So I'm delighted to hand over to Ben, and he will take us through the Values Awards presentation this afternoon.
Thank you very much, Claire. Congratulations to all of our winners thus far, sitting and listening both yesterday, last night and this morning. It's truly great recognition of the many hundreds, if not thousands, of wonderful people we have working within our organisation. And as we look to the next chapter, as Claire mentioned at the beginning, as Grampians Health, what a wonderful platform we have to launch into a new organisation with Ballarat Health Services staff demonstrating such amazing values, consistent values, day in, day out. So thus far, congratulations to all of the award winners, but very, very pleased to have the opportunity to participate and share some more stories, some more good news. I'll take the opportunity to acknowledge the traditional owners of the land in which we meet, Wadawurrung people, and pay my respects to their elders past, present and emerging as well. The first award that I'm going to award is that of teamwork. Everyone knows our values are teamwork, respect, accountability and compassion. I think they're wonderful values, and I see examples of them day in, day out. I hear about examples of them day in, day out, and it's right that we celebrate those who have gone well over and above what we would normally expect and are recognised today. How we classify teamwork at BHS, there's a number of categories: working together and maintaining productive working relationships, valuing our workforce, their experience, skills and knowledge, celebrating success and working through challenges together, considering patients and carers as part of the team. And I guess, you know, as I reflect upon that, I think the last 20 months have been unlike anything I've ever experienced, anything unlike we've ever experienced as a health service, as a community, as a global community. And what I think has stood us in such great stead has been the teamwork that BHS has demonstrated, the leadership that BHS has demonstrated throughout such disruption, throughout so much unknown, as we've navigated and continued to fulfil our role as community leaders. And I'm not just talking about those who are formally recognised in leadership positions. I'm talking about every single person who's had a conversation with a relative or a friend because they've recognised you as someone who comes from BHS and they've looked to you for leadership. And I do want to congratulate everyone on your contribution to what to date, and I expect will continue, has been a really phenomenal effort in the face of a very difficult challenge. The winner of this year's Teamwork Award, I'm very pleased to announce, is Ward 4 South at the Ballarat Base Hospital. What we do now is we cheer and clap, but in the absence of that, I'll talk a little bit more. 4 South were nominated by multiple consumers and their families this year. You know, the nominations all differed. They all made reference, though, to the quality of the management of the care, the professional attitude, the caring, and most importantly for this award, thank the team for the broad quality of care from across the disciplines, whether they be nurses, doctors, the clinical support staff, the cleaning staff, the rehab staff, the physio staff, the catering staff, the students, you know, a genuine team of many, many different disciplines and backgrounds. Many of our patients and their families mentioned the challenge of no visitors, and you know, it's pretty diabolical for families, but it's pretty diabolical for staff having to have those difficult conversations. And I just want to recognise how difficult that has been. Yes, we all understand the reasons for it, but that doesn't make it any easier, particularly in the face of the circumstances that those families were facing. So, you know, from me to you, I really want to thank and congratulate Ward 4 South, and ask Kelly McDonnell and Steve Medwell to represent Ward 4 South and accept this Teamwork Award. Kelly.
Hi everybody, I'm covering Linda while she's away, so I'm more than pleased to accept this award. Just talking from my personal experience on 4 South, I've worked here for 8 years now, and I know how well we work together as a team. And, you know, I probably wouldn't be here if it wasn't for the people. It hasn't been the easiest time the last 2 years for everyone, but we've had a lot of changes happen. And, you know, we've rolled up our sleeves and we've worked together. You know, the nurses, allied health, domestic staff, ward clerks, everybody. So I really can't praise them enough. It's just really nice to have that recognised formally, and I've passed it on to everyone, and we're very pleased to accept the award. That's it.
Congratulations, Kelly.
Thank you.
Well done. Now, I'm not sure if Steve Medwell's going to add anything. Obviously, he started a little bit earlier with his recording. I don't know if he's going to do a live cross or we leave Kelly to it. But nonetheless, he'll interrupt me. He's pretty good at that if he needs to. But nonetheless, I'll forge ahead. But also want to recognise that all of our facilities, not all, but most of our facilities are not the environments that we would like them to be. 4 South is not a particularly contemporary environment, and that just makes it all the more impressive that the staff are able to deliver such impressive care, and that care recognised by the beneficiaries day in, day out. So congratulations, Kelly. Congratulations, Linda, and to the broader team, and congratulations, Steve. The next award is that of compassion. As Claire mentioned, I take a particular interest in compassion. I think it's a value that is imperative in everything we do, day in, day out, whether we're at work, whether we're at home, whether we're doing the shopping, whether we're attending other types of events. Compassion is critically important, and I do recognise there is so much compassion that occurs within our organisation, but also across our community. And whilst we have our share of very, very challenging historical events within our community, whilst we can't right those wrongs, we can certainly do our level best to make things better from here on in. BHS defines compassion as recognising each other's differences in culture and diversity, ensuring confidentiality and privacy at all times, being prepared and on time. I might have to work on that. Listening to others and welcoming and acknowledging others. And this year's Compassion Award winner, I'm very pleased to say, is Karen Benker from the Youth Mental Health team. The challenges that everyone has endured, our own mental health through the challenges of the last 20 months. For someone who already has a mental illness, has vulnerabilities to have to endure so much on their own. The nomination form from a consumer nominating Karen is a heartfelt message, and whilst I won't go into the detail of it, it's a true credit to you, Karen, that you were able to build such rapport and show such empathy with your client, and to recognise their suffering and to do something about it. And that's what compassion is, to recognise that someone needs your help. And you're an outstanding clinician in the view of this consumer, and I take their word for it. So congratulations, Karen. It's a wonderful recognition. Everyone knows that mental health, in terms of the service system that we deliver, that we operate within, has so much more that it could do. And we're starting to see a lot of resources in terms of money flowing through. And that's important, it's a critical enabler. But at the end of the day, it's people. And it's people like Karen Benker who are going to stand us in good stead, are going to represent us and support our community through the challenges that we all face, whether it be now or whether it be tomorrow. So Karen, congratulations, well done, and handing over to you for a couple of words.
Thank you, Ben, and good afternoon to everybody. I am extremely humbled to receive this award. I would never in a million years expect that I would be nominated, let alone Sorry, just a little bit nervous. If I could just share a little bit with you all, a little bit about my role. I'm actually based at QV, and my work doesn't only encompass our youth clients, but also our adult clients. I am part of the lived experience workforce, which is an expanding team. What else can I tell you? In my role as a post-discharge peer support worker within the lived experience team, I engage with people that have been discharged from the AAU in the first month after their discharge. And my role is very varied. It may just be providing a little bit of support over the phone or meeting up with somebody for a coffee, but it's also much more than that. It's about understanding how a person feels re-entering the community after being in the acute unit, and just trying to walk alongside them as they progress through their journey. I think peer support in general is very important. Our team is about to expand with other peer workers across the service in mental health. Look, I'm extremely humbled, as I said. I think there are so many deserving people who live this value. I come across them every day. I'm speechless, really. So thank you very much.
Congratulations, Karen. You're getting an enormous amount of love coming through in the comments, and rightly so. Mental health services in Victoria have over a long period of time supported, promoted, employed lived experience workforce units, and I guess that partnering with people to deliver care is a critical lesson that mental health has a great deal of experience. The mental health services have a great deal of experience with, and celebrating that is critically important. So congratulations once again, Karen.
Thank you.
Our next award is that of respect. And BHS defines the value of respect as caring for the health and wellbeing of our patients, staff, colleagues and visitors, providing excellent care, treating patients, family members and staff with sensitivity and empathy, being supportive of and nurturing towards our staff, listening with kindness to our patients and each other, considering decisions that embrace patients and consumers' preferences, values and needs, working in the best interests of our patients and consumers. And I guess that really demonstrates that part of providing a shared commitment to delivering care in partnership with patients, consumers, clients, is that of respecting their wishes and respectfully collaborating with how they would like to receive their care, even if sometimes we may disagree that it's the best thing, that we do have a respectful conversation. And I guess that'll be a lot of the work that, or some of the work that Karen would find herself doing, making sure that people clearly have good understanding, are respected, their views are respected, and we collaborate as best we can. But nonetheless, the winner of the Respect Award for 2021 is Michelle Monger, the Nurse Unit Manager in Aged Care. Michelle was nominated by one of her colleagues, and I'll read those words. I've worked with Michelle for many years across various roles and have always been impressed by the dedication and compassion she's shown to the residents in our residential care facilities. However, she's recently gone above and beyond in assisting a resident from a CALD background to move to a more culturally appropriate facility in Melbourne. She'd clearly spent a lot of time listening to the resident and finding out his wants and needs, and had been attempting to meet these, such as supplying culturally appropriate food whilst arranging his move. Michelle facilitated meetings between the resident and the new facility and explained each and every step along the way. It was clearly evident that she'd built a trusting relationship with the resident where no one had managed to before, and it was also evident the resident felt listened to and validated. Michelle works with all her residents in this way and always puts their needs at the forefront of her work. Congratulations, Michelle.
Thank you. It's an honour. Very, very shocked at this, but I'm just humbled, and I do what I do because I'm just passionate about what I do. So thank you very much. Just to note, the resident has settled in and is enjoying the cuisines that come his way. So, and I still keep in touch monthly just to make sure everything's going well. So thank you.
I guess that's a great sign of his appreciation, Michelle, that he continues to stay in touch with you and very much appreciates your efforts. So congratulations to you and well done. As many people will know, BHS is the largest provider of public residential care services in the state of Victoria, and that only increases as we become Grampians Health, and puts us, I think, a little over 600 beds. You know, it's people like Michelle Monger who will lead the way and show others how it's done, how we demonstrate respect in our daily practice, how we interact with people at a human level. Congratulations, well done. Now, the final award we'll present today is the Living Our Values Everyday Award. And pleasingly, our Chief Executive, Dale Fraser, who's been committed to other activities up until now, has joined us. And on cue, I'll hand over to you, Dale, if that's all right. And if that's not all right, just shake your head and I'll forge on. But people would love to hear from you.
Thanks, Ben. And congratulations to all the award recipients today. This week is one of the highlight weeks for me every year, just to sort of hear the incredible achievements of staff in terms of the work they do on values, the work they do as team members, the work they do in research and education, and of course the incredible opportunities they have in terms of the service awards. So I'm absolutely delighted to be here today to present the Living Our Values Everyday Award with regard to accountability. So Bell Health Services defines accountability as supporting excellence in care and following best practice, taking personal responsibility for actions and results, and acting as positive role models and leading by example, ensuring that a safe and healthy workplace starts with me, it starts with everybody. Following through on our commitments on a timely manner, communicating in a direct and clear way, and adhering to organisation policies and procedures. Without accountability, we don't really exist. Care, compassion, respect, accountability, they all go together to make us who we are. It gives me great pleasure to announce the winner of the Accountability Award and the overall Living Our Values Award for 2021 goes to a very deserving unsung hero group of this organisation, which is the Environmental Services team. 2020 and 2021 have placed healthcare workers in the spotlight for a very good reason. And for recognising great work, there's also a place to recognising those unsung heroes who amongst us might not be the front and centre, but nonetheless do their very best every day so that we all have the opportunities of providing great care. The Environmental Services team received a number of nominations. A special mention must go to Craig Chuck Berry, and no surprises there why he's called Chuck, who was recognised for the great work that he does with the Dental Services team. Working together and maintaining productive working relationships is at the core of what the Environmental Services team do. The team have shown flexibility and a great work ethic when moving numerous staff out of the brick and onto other areas and out of the QE. They are polite, engaged, hardworking, and got the job done. Sometimes confusing circumstances with boxes and things everywhere. The environmental services team were respectful of the staff, ordering them around it sometimes. Felt sometimes others were not so respectful to the enviro team when we were all valued members of the PHS. On a personal note, I know Don has had a challenging period of time with some personal issues, and I certainly sincerely wish Don the absolutely best. And you know, I've never found the enviro guys and girls anything but courteous, quick with a joke, a happy smiling face, and real ambassadors to this organisation. It gives me great pleasure to award them this award and call forward whoever's going to speak on their behalf to accept the award. John?
Yeah, thanks, Dale. Yeah, I think our group are quite achievers. We go about our jobs. It's been a very trying 18 to 20 months. I thank my leadership group for all the good work and the extra challenges that we've all taken on in our new world. Everyone's our customers, and that's been a thing for 30 years, not just the last 18 months. Every single person in this organisation, visitors, customers, patients, staff, they've all been our customers, and it's always been a thing where we endeavour to provide a quality and timely service to them all. And, you know, from top to bottom in the department, I thank everyone for all their work, and we strive to do the same thing in the following years. So very grateful for the award, and thanks to everyone.
Congratulations, Don, and congratulations to the entire team. You know, I am very sincere in what I say. You know, the work that the team does is incredible, often in very difficult circumstances, and you do it with a great style and with great humility. So congratulations.
Thanks.
I'd like to thank all, in closing, I should say, I'd like to thank all staff and consumers who participated in the judging panels for today's event, and acknowledge that, and importantly, also acknowledge the staff members that have taken the time to nominate a work colleague. Every year we have numerous people do countless heroic acts associated with our values, and I would just encourage everybody to take a small moment every year just to recognise and to call out great behaviour, because we're all in this together. These are tough jobs. We all deserve and need positive affirmation from time to time. So please, if you do see a colleague or a team doing something that you think deserves recognition, please do make note of it and let somebody know. Let a supervisor, let me know, let somebody know, so that we can have staff and others recognised with regards to the records. This formally concludes the celebrating our People's Awards for 2021. I'd like to ask you to join me in again congratulating our nominees and winners for this year. The nominees and winners will be presented with their certificates by their various executives in the coming weeks. And hopefully when we can get through this misery of COVID, we can come back together as in person and look forward to celebrating a great 2022. Thank you very much for joining the team this afternoon, and once again, thank you very much for those that have been nominated and the winners. And please do enjoy the rest of your day, and please be safe, and please enjoy a Merry Christmas.
Thanks, Dale.